Hello, and welcome to your OBGYN rotation. My name is Philip.
And my name is Beryl. These videos will provide a brief overview for your obstetrics and gynecology rotation at Brigham and Women's Hospital.
All right, welcome to labor and delivery. You're gonna come off the ASB1 or the K elevators. You're gonna walk straight through the doors here that say Center for Labor and Birth, past our OB triage here on the right. And the first door you're gonna come to on the left is the resident room. This is where all of sign-out's gonna happen. Most of you will have badge access. If you don't, just go ahead and knock. So this is where sign-out happens every day at 7:30 in the morning, except for on Wednesdays when it happens at 7. And then again at night where it's 6:30 at night every day, except for the weekend, Saturday and Sunday, where it's at 7 p.m. When you come in, if you don't have a piece of paper, grab one from the printer here. And then this is the table where the ongoing and off-coming teams sit. Oncoming here, off-going there. All right, the attending usually sits at the end of the table down here, so go ahead and have a seat somewhere here towards the end of the table. And this is the board. This has all of the patients who are on the labor and delivery floor at the top, and then in triage at the bottom.
You can organize your sheet by folding it into 8 squares and placing one patient per square. The squares are organized by writing the patient's name at the top. Next to that, you'll put their age, G's and P's, and gestational age. Directly below the patient's name, you'll write the patient's presenting problem. On the right side of the square is where you'll put the patient's labor course, including times of exams and any interventions that are performed. And on the left side of the sheet, you'll place any maternal problems that are presented. Finally, across the bottom of the square, you'll put any information regarding the fetus, including estimated fetal weight and GBS status, as well as presentation being vertex or breech.
You're gonna go through the door leading to the res room, back in, and then head out to the floor. Labor rooms go from room 2 all the way around to room 25. At this point, we've looped all the way around back to labor room 25. And if you continued straight through these double doors, you'd get back to the resident room. Through here is the L&D ORs. As you walk back to the operating room, what you're gonna wanna do is grab a head covering here and a mask, which you can find up here. You can also grab booties for your feet if you want, they're down here. So there are 4 operating rooms on labor and delivery. We're gonna head into operating room 1, which is here. When you walk into an operating room, the first thing you should do is introduce yourself to the circulator and the scrub tech. And then you should come over to this area and grab your gloves. You should always double glove, they're down here. And then you should grab a gown as well, which is up here. Once you've done that, you can come over to the OR table and you can either open the gloves yourself onto the table, or if you feel comfortable doing so, you can hand them to a nurse or ask the scrub tech to walk you through it. At that point in time, you should ask your resident how you can get the patient ready for surgery. Finally, once we're ready to scrub, we're gonna head through this door to the scrub sinks for eye protection and for scrubbing. You can get your eye protection up here, and then your different scrub options are here, and then your Avogard is over here. Please refer to the gynecology video for information on how to scrub. Coming from labor and delivery or from the operating room, there's 2 different ways to get to triage. The first is through these double doors. You're gonna head straight through and take a left to get to the triage area here. Coming from the resident room, you can head through these double doors and enter triage here on your left. So the workroom is immediately to your left, which is where you can read about patient information or have computer access. This is where the residents or attendings will sit. There are 8 rooms on labor and delivery triage, which are all the way down here. Think of L&D triage as basically a small emergency room for pregnant patients. It's also the first place you'll see patients when they come to labor and delivery for evaluation or for induction.
Thanks for watching. We really hope you enjoy your time with us.
And if any questions come up during your rotation, please feel free to reach out to your resident mentor or to talk to any residents on your service.
Good luck.